What do you do with a grabby patient? A grabby patient. Patients that like to grab. What do you do? Let's come back and talk about it. Yes, what do you do if you have a grabby patient? So if you don't understand what I mean patients who like to grab, touchy-feely patients. For females, for those of us that work in the nursing field, we come across grabby patients, grabby males. They grab at your boobs, they grab at your buttocks. Sometimes they will make a beeline for between your legs. They do that. Some want to grab you and hug you because in their mind, that's what they're thinking. But what do you do with patients like that? Well, for one thing, you're not going to punch them in the eye. You're not going to shove them. Neither you're going to slap them or drop kick them. You can't do any of those things, unfortunately. But then again, you're not allowed to get into fights. It's against the law. You can't go around fighting because we don't live in a primitive world. But even more so as a professional, a caregiver, well, you're not going to be beating on your patient because then you'll be looking at jail. So what do you do? For those that you can redirect, you will keep on redirecting them. And then let's again document. Let your DON know, let your supervisor know. And then you put things in place. For one thing, don't dangle your boobs in front of them. Be protective. You have to be proactive in your own way. So, this person grabs. So you're just going to, again, find a way that you're not all up in their space and preempt them. They're going to do things like that. You stop it before it happens, okay? Now, some people think, again, just the fact that they're grabbing you, there's nothing you can do about it. I don't want to give that impression because you can ask to change your assignments. You really can. But good luck with that because with all these shortages of staff, you're pretty much stuck with what you have. However, if it becomes something that you become so uncomfortable with, well, then you want to be able to have that discussion with your DON and they can change your assignment. That's what they're there for. They should be able to when you make a case of it. Because again, you don't want to work in a hostile environment. There's nothing cute or good about that. And everybody has a limit. We don't want you snapping. Because again, it gets to be too much. They could grab you in such a way that it hurts you. Point in case. People think only women get grabbed. Men get grabbed. I have been with students where my male student was grabbed. Yeah, right in front, his genitals. And it hurt him so much. Not so much the fact that she crossed the line and touched him. But I didn't think of this at that time. But I think that she probably hurt him when she squeezed. She probably squeezed but he was very, very upset. He was very, very upset. I mean, to the point of like he quitting, or I mean he was upset that he went to the bathroom, maybe he was crying, I don't know. But I didn't at that time. I thought it was just because the girls around him, the female around him, thought it was funny because we as females get grabbed all the time. So just seeing another guy go through it, it was like, oh, okay, well, finally, right? Someone being harassed, because this is what we as female, we go through, whether we want it or we don't. No one's asking. But I think later on, someone brought it to my attention that he was probably hurt. Okay, so what do you do in a situation like that? First of all, when there are patients, when they start to grab or those touchy-feely, they really need to touch. They kind of have a history. Other people, it's been reported. You got to report it. You got to document it. You got to let them know. And just, again, protect yourself around such people because that behavior is being established. It might be that you're the first person that it got established with. That's why we need to document. That's why we need to be talking, okay? Because yes, they're crossing the line, but something also you need to take into consideration is that a lot of them are probably dementia patients or people that have been compromised cognitively. And so you can really, I mean, what are you going to do? You're going to sue them to court? No, it's about you protecting yourself. So it depends on how bad it is. Then you have to take some proactive actions. And one of them could be change assignments. Okay, change assignments. But you also have to protect yourself. You have to protect yourself. If you know that a woman is, or those patients are going to grab at you, then you don't get too close to them where they can reach you to hurt you, because it can hurt you. What are you going to do? You cannot, first of all, what are you going to do? Are you going to grab her boobs back? You can't do that. Are you going to pinch her? You cannot do that. Okay. That's just the truth. You can't do those things. So, yeah, grabby patients, they are grabby, but a lot of them have been cognitively compromised. Some have mental disorders, okay? And those are the ones sometimes they are manipulative and they're not necessarily having dementia. They just think they can push the envelope. Now, for those, you can redirect and let them know what they're doing is wrong. Now, I do remember an instance. Oh my God, I have so many stories, guys. I have so many stories. And I remember this unit. I've not worked it before. Like I've shared with you guys, I've done agency work. I've done full time. Don't get me wrong. I've been doing this 20 plus years. So I have done all that. But in recent times, I do a lot of PRNs. Okay. And that's just my way to cope with all that. I just need to be able to exhale sometimes. So sometimes I just don't want to be around you guys. Okay. But anyway, and so what happened? The thing was, so I was on this unit. I don't usually work the unit PRN. So it was like a split unit, which I hate, by the way. For those of you who work in the nursing home and even in the hospital, assisted living, anyway, you have patients. When you have to work splitly, I just want to be in my unit. I don't want to move from one unit and go to another one. I hate the split unit. And I might just talk about it. I'm making points of things I'm going to talk about. Okay, so as I was doing my thing, and then this youngish male noticed me, and I saw him zoom past me to his room, and I'm thinking, oh, very nice, because he knows I'm going to be going there because I need to check his blood sugar, then check because he's on a sliding scale and what have you. So I'm going to be covering and then giving him his meds. So as I got there, he was already in the room. So I went in the room. Now, as I got in the room, he was right there in bed, exposing himself and masturbating. Again, the reason why I'm using this was because we're all healthcare providers and health caretakers. So I'm going to say the word, we're not squeamish. This is what we do. So when I got there, I was taken aback because I'm like, what? What's it doing? So I'm like, and he was looking at me. And then I'm like, okay, what I'm going to do, I'm going to give you, privacy. Okay. And I'll go back and I'll come back and give you a medication. She's like, no. Come in. And as he's talking to me, he's still doing what he's doing. So clearly I know, okay, I don't know what his story is, but I wasn't going to go in because I had a feeling I might be enabling him and he's thinking he's okay. And first of all, I was put off, really, I was. Because again, whether you like it or not, for those guys and women who think that playing with yourself in front of someone who really doesn't care is not cool, okay? I just thought I'd throw that out there. But anyway, so I went back out. So the CNA person saw me come in. I'm like, this guy, what's his story? He's like, oh, was he playing with himself? I'm like, yeah. He's like, oh, that's what he does. He does that. He does that to some other nurses too who don't know, but that's what he does. And you just need to stop. That's what he does. I'm like, oh, that's his story. So I went and checked his chart because I would do that, especially when I need to know how to take care of my patient in the right way. So I went and I saw that, okay, he's one of those people that he just needs to be corrected, okay? He's not dementia or anything. It's just a behavior that he thinks he can get away with, and he tends to do it with younger nurses. And I probably look younger to him, even though he was much younger than me, but he probably saw me as a younger person. Okay, I'm like, all right. So when he came, so he now got on his bell, his call light. And the aide went in there and he's like, tell the nurse I'm ready to receive her now. I'm like, okay. So I went in there, and this time again, when he saw me coming in, he quickly jumped on the bed. I'm like, and then he was I'm like, please do not do that. So let's set some rules. And that's exactly what I did. I'm like, let's set some rules, okay? This is what we're gonna do. I don't mind giving you your medication in your room, okay? That's fine. However, you will not be exposing yourself, okay? You need to set those boundaries now. If you keep doing that, I will tell the DON, and then I will not be coming into your room. You will come out to the nursing station to get your medication. Oh, that took care of him. That was it after that. I'm sure he's like, oh, please. This one I can. Again, there are ways to deal with situations like that. I'm an OG. I've been doing this. So you kind of know those you can do. And then if he had been someone who didn't even know what he was doing, and he had dementia or some type of cognitive challenges, well, then there are ways to deal with that, But this one I knew it was just him just misbehaving. So yeah, you always have those grabby folks, okay? And there's nothing as annoying as being grabbed at when it's unwarranted. You don't want nobody wants their boobs grabbed or their buttocks or their genitalia. Nobody cares for that, okay? It's not cute. However, I would say patients like that, you need to preempt them and know how to stand around them. And then those that you can give boundaries to, you tell them, no, it's not acceptable. You cannot do that. For those that can understand you, because some of them can. You, however, need to document. I keep telling you guys, you got to document stuff to cover your butt. And you're going to hear that a lot in the healthcare system. Cover your butt or cover your ass. And then let your supervisor know. Let your supervisor know. If you have to change assignments, then go ahead and do so with proper documentation. Let them know why you're doing it. It's not like you're choosing not to do that care. But then you, again, as a worker, you need to be able to work in a non-hostile environment. So if it's something that's compromising your care, is not letting you work in a way that you ought to, then you need to speak out and have your assignment changed. So I'm hoping that you got value on this topic I talked about, because there are grabbers out there, and you just need to be able to know how to take care of it. And if there anything that you want to add to it, please feel free, because again, these are things that always come up. So again, please give me likes, hit the notification bell, and subscribe to me. I'll see you in the next video.